All right. So, which of the following intervention is the most appropriate for this patient? So, a 50-year-old man with a history of rheumatoid arthritis is being tapered off long-term prednisone therapy. He presents to clinic with fatigue, dizziness, and abdominal pain. Laboratory reveals low morning cortisol and ACTH. So, which intervention would be the most appropriate? So just think about what he has, right? So low morning cortisol and ACTH. So it could be something with the parietal lobe. No, sorry, not parietal lobe. Oh my God, pituitary gland.
Okay, good.
I'm
Okay.
so sorry. Pituitary gland, right? Because ACTH and then goes to adrenal and then cortisol. So definitely something wrong with that. Um, in terms of intervention for this, he has arthritis. Um,
So what's the diagnosis? Why this patient? Why all of a sudden they have low cortisol and ACTH levels?
There's no way that this could be related to Cushing's. Like, there's no way.
Okay.
Um, or SLE can't be that one either. Could it be just, could his symptoms be because of the prednisone therapy?
Yeah, good. Good. So long-term prednisone therapy, right? So now you have to connect that. So if you were on long-term prednisone therapy and now you're getting off it, how can that cause low cortisol and ACTH levels?
Because I think the prednisone, um, like how could it cause it? Because of the high prednisone, it kind of like stimulated ACTH to produce less because prednisone is like a form of like cortisol in a sense. So I'm thinking like it just like told it to like produce less. So in
Yeah.
turn,
So it
you get
suppressed it, right? So when you were on long-term prednisone, it suppressed your ACTH levels of your pituitary, meaning you create less systemic cortisol. Okay. So now that you got the diagnosis, what do you want to do next?
what I want to do next is perhaps maybe do an um MRI is what I
Okay.
want to do just to
Okay. Final answer.
yeah, go with that.
Okay. So here, right, adrenal insufficiency secondary to long-term prednisone use, which kind of what we talked about, right? Less pituitary secretion, and then also your adrenals are not working well either, right? And so what you want to do is initiate some kind of therapy, right, to replace the deficient cortisol. So hydrocortisone therapy, to kind of replace that as it's kind of coming back, right? So, you know, concentration stimulation test is used for primary adrenal insufficiency or Addison, right? So this is not going to be kind of due to kind of primary, which is Addison's, right? Increased prednisone, right? As the goal is to taper off prednisone, increasing would further suppress the HPA axis and worsen adrenal insufficiency. So don't want to do that because you're trying to take them off prednisone. Levothyroxine is used for hypothyroidism, not for this. Pituitary MRI, right? It's really used for imaging to see if there's a tumor or any structural issue. We already know that this is a medical issue, so the MRI is not going to give you any extra information. So you need to, since this is a clinical diagnosis, you need to start the treatment, if that makes sense.
It does, but why would you want to remove someone from prednisone just to put them on hydrocortisone?
Yeah, so prednisone, right, is going to be for her rheumatoid arthritis. The hydrocortisone, right, is kind of a replacement cortisol level, and it's kind of on a slower, how do I say this? It's only temporarily, right? You want to give them like something very similar to cortisol, right? Because they're missing systemic, and over time, you're hoping that your adrenal glands will wake up again.
Okay, I see. Yeah, that's the reason why I didn't pick hydrocortisone because I was like, it does the same thing as prednisone. So I was like, why would you put them on hydrocortisone if they're on prednisone?
Yeah, because you're
That
trying
was
to
my
take care of them off on prednisone, right? So
mm. So it's like a low dose
yeah.
prednisone in a sense.